Given that EGFR and ALK mutation testing or ALK rearrangement testing are standard of care for patients with lung adenocarcinoma, I think it's extremely important to get that information. Sometimes it's a challenge, though. When patients initially have their biopsy performed, oftentimes it's a fine needle biopsy or some other small biopsy that doesn't lead to enough tissue being present to allow mutation testing. So we have to decide on a case-by-case basis whether patients should have another biopsy prior to beginning therapy, or in some cases after beginning therapy, before we decide about their second-line therapy. The particular example of a first-line therapy, when you see a patient who has inadequate tissue for mutation testing, what do? Do you send that patient off for testing right then and there? Do you start them on first-line therapy and then wait? I think it's a challenge, and it's a case-by-case basis. What I recommend usually, though, is if you can do mutation testing at that time, i.e. that the patient doesn't have significant symptoms from their cancer and there's no other reason to do a procedure, then you should send them off for a new biopsy. Sometimes when patients initially present with lung cancer, they have need for another procedure. In that situation, you can take care of that procedure and get tissue. And the best example of that is patients who have malignant pleural effusion. So that's fluid between the lung and the chest wall that accumulates in many patients with lung cancer. One of the ways to manage that problem and take care of it definitively is to go through something called a video-assisted thoracoscopic surgery with pleurodesis. In that situation, the surgeon can often obtain additional material and allow you to get that mutation testing result in the process of relieving one of the big symptoms, shortness of breath related to lung cancer. Now, timing of additional biopsies, if you've decided that you have time at the beginning, that's the best time to do it. Oftentimes we don't have that luxury. Patients are symptomatic, need to start some sort of chemotherapy, and you decide to start chemotherapy without knowing mutation status. When do you do that second biopsy? And I don't think anybody has a good answer for that. I think that my inclination is to do it when I begin to see hints of progression on CAT scan. If after initial response, the tumor has stayed stable for a while, and then we start to see slight growth of the tumor. Not enough that I'm convinced that it's growing and I need to change therapy, but that it makes me worried that I will need to soon. I order the biopsy at that time.